Flex Physiotherapy. I just wanted to do a short talk today about mechanical back pain, and specifically some myths associated with mechanical back pain, because it's one of those subjects that everybody thinks they know something about, and there's a lot of myths that fly around in this area. Now, it's important that that we recognise that actually this is just general principles that I'm presenting here. It doesn't constitute clinical advice. It's important that you get a diagnosis from a suitably qualified medical practitioner. So myths. The first thing to know about back pain is that it's really common. Around about 80% of us will suffer from some form of back pain at some time in our lives. It's a really common thing. Essentially, there are three types of back pain. The first type of back pain is when there's something serious going on, like you've got an infection or a tumour or something like that. Thankfully, that's very rare, probably 1%, something like that. The second type of back pain is when you've got significant leg pain associated with that back pain. Okay? And if that leg pain is as a result of a nerve problem in your back, a nerve compression in your back, or nerve irritation in your back, then you can get kind of quite sharp, lancinating pain down your leg, and you can also get some pins and needles, numbness, sometimes some weakness to the muscles as well. So that nerve type of back pain is a little more common than serious pathology. Around about 5% or so of back pain will have a nerve element to it. Now, the rest of back pain is kind of lumped into this group that we call mechanical back pain. All that means is that there's back pain which results from pain emanating from some of the moving parts of your back. Now, we often think of the back being a weak structure, okay, and that's one of the common myths that we have about back pain. Actually, the spine is an incredibly strong structure. Okay? So, with the spine, you have the disc is a tough fibrous structure. You have tough joint capsule and ligaments at each level of the spine. You then have small muscles which knit each segment together, and then you have bigger muscles over the top. It's an extremely strong structure. Okay? So try not to get caught into the trap of thinking that, you know, when you have this acute bouts of pain, your back is weak. It's not weak. Now, another thing that sometimes people think is that once they have back pain, they're always going to have back pain, and that's just not true. Your back is essentially made out of the same stuff that your ankle is made out of. Now, with an ankle sprain, you'd expect it to take 6 or 8 weeks to get better if it's a bad sprain. And really, if you're dealing with simple mechanical back pain, there's no reason why your back shouldn't get better in the same sort of time frame. Again, the structures are the same. It's just the way they're put together is slightly different. Okay? So just because you have back pain doesn't mean you're always going to have back pain. Generally speaking, it's a good idea to try and get yourself back to full fitness again as soon as you can. Slouching. Now, we often hear that slouching is bad for us. Actually, there's no real evidence that slouching is a bad thing, and we all slouch, and that's absolutely fine. Now, if I stood here like that, okay, bending my little finger back, okay, for the next 3 or 4 hours, I'm probably going to get a sore little finger. And the same is true of your back. Okay? If you slouch for 3 or 4 hours without moving, well, you might get a bit of back pain. But slouching in itself is not a bad thing. Flexing as well. We constantly talk that you must keep your back straight, that you must bend your knees. And the same thing is true, really. If you were to pick a pen up off the floor, then it's entirely appropriate to flex your spine. Okay? Your spine is designed to flex, to twist, to move. If I was to go down and pick up a TV, then clearly I want to keep my back straight, I want to bend my legs, and I want to be quite careful about that. Okay? But slouching is not necessarily bad, and flexion is not a bad thing. Okay? back is designed to flex and to move. We mustn't rest excessively, okay? And that's another myth. If you have back pain, you must rest. We used to be told that you should be on bed rest for a period of time. If you've got back pain, don't rest excessively. Resting for 3 or 4 days is absolutely fine, okay, if it's a nasty bout of back pain, but then you need to try and slowly get yourself back to full activity again. Last couple of myths that I wanted to deal with. I need a scan. Okay, a lot of people think when they have back pain they need a scan. The problem with that is that because scanners are becoming so powerful now, we're actually establishing that what we used to think is abnormal, we now know as completely normal. So, for example, 80% of people who go through an MRI scanner will have evidence of some degenerative disc disease in their back. Around 60% of people will have evidence of a disc prolapse, okay, or a slip disc or a bulging disc. These are people with no pain whatsoever. Okay? So, scanning, MRI scanning for simple mechanical back pain is often just not helpful. And the last myth that I want to deal with is surgery. I need surgery. Now, if you've got simple mechanical back pain, there's actually good evidence that exercise-based therapy is just as beneficial as surgery, and obviously you don't have the risks associated with it. Surgery becomes more likely if you've got significant leg pain, significant neurological symptoms in the leg, and you have MRI scan evidence of compression to the corresponding nerve in your back, then surgery starts to become more likely. But in general terms, scanning's not helpful and surgery's not helpful. So I hope that's been some useful advice and information for you. Once again, this is Kieran here from Flex Physiotherapy, and I look forward to seeing you again soon.